Africa has seen a lot of incidents where anti-migrant group Operation Dudula blocks foreign nationals from accessing public healthcare services in the country. Now, South Africa's healthcare service has always been in the spotlight, and this is due to its failures to cater for the poor. Health Funders Association has organized a symposium with the theme Healthcare 2030, Building a Health System We Deserve. We have roped in Thoneshan Naidoo, who's Chief Executive Officer at Health Funders Association. Mr. Naidoo, thank you so much for your time this hour on the program. So let's start with this. You know, South Africa's constitution guarantees the right to health care for all, yet we've seen incidents where the likes of Operation Dudula, for instance, comes to strongly block what they call illegal foreigners from accessing facilities. Just how do we reconcile the tension between, resource constraints and constitutional obligations to provide health care for all within the borders?
Sure, great. So, Operation Dudula is quite a touchy issue. I think it goes back to, firstly, our Constitution says everyone has right to access healthcare services and includes everyone in South Africa, asylum seekers, etc. So while South Africa has, a public and private healthcare system, which is the issues at hand, they are interconnected. And if one actually fails, one system fails, the other is actually affected. And just to give an indication, most people know about medical schemes. We've got about 9 million members there. But in actual effect, up to 40% of South Africans, or the population of South Africa, that's up to 25 million people, actually make use of the private sector as the first point of call. And that's because we have issues, unfortunately, in the public sector, which is well documented. So many of the South Africans, out of frustration and need access to healthcare, turn to the private sector. So it's not to say that the private sector is perfect, right? It has its flaws. But ultimately, South Africa needs a functioning and a sustainable healthcare system, which requires alignment, collaboration, and importantly, healthcare reform. And without this, we risk duplication, inefficiencies, and a system that's going to fail everyone.
Interesting that you touch on that there is a need, and you say the need is for a functioning as well as a sustainable sort of healthcare, sector for us. And ideally, Mr. Naidoo, what would those reforms look like in a practical sense?
Sure. So, there's actually a lot of work that's already been done. So if you take, for example, the health market inquiry, which was completed in 2019, now they documented some of the healthcare reforms that could make healthcare, private healthcare, more affordable today to medical scheme members. And if those were actually implemented, the current contributions we're paying would be up to 30% less. Unfortunately, these are some of the reforms. And when I talk about it more specifically, it is, for example, moving from fee-for-service, where we pay for every interaction, towards moving to value-based contract, where we pay for outcomes. I mean, fundamentally, when anybody goes to healthcare, right, your achievement is you want to get healthier. And we must move away from paying for a service and paying to value-based contract. So that's one, right? I mean, and the other opportunities which we need to do is fundamentally the workforce growth. We have significantly, under-resourced in terms of healthcare. We need to enable policies that expand the pipeline of doctors, nurses, and allied professionals. We need to invest in capacity building. And then, one important thing is our regulations need to be forward-looking and enable things like digital and data tools, because digital tools, there's a number of them, digital therapeutics, etc. They provide access to healthcare, for people that are far out, but also provide quality healthcare through technology. So, and as well, if you think about it, the private sector is probably one of the world's best across the globe, probably in the top 5. We've built that, world-class system on technology. We've got the fraud-based analytics. We've got tons of things. And our view is, we can work collaboratively with the public sector to build something that is going to be for the benefit of all. And we've got the skills, we've got the knowledge, we've got the experience.
And also, perhaps, Mr. Naidoo, many conversations have been had on end in terms of how do we fine-tune these structures and maybe just make sure that they are properly built for purpose, particularly when we look at the health care sector. But critics have also warned that, bringing about changes, successive changes may push more people into an already strained public sector. Just what mitigation package would you propose to avoid capacity collapses during the transition?
Sure. I can critically say, we're already at a point in time currently where healthcare reform has stalled. Most of us that are in medical schemes will be hearing about new packages, prices, contributions for next year, and they're probably going to be around, the 8 to 10% increase.
Yeah.
Now, that's far higher than what salary inflation is going to do. So what we need to do is actually, we don't need to go any more further, but look at the extensive health market inquiry. We need to sit down with government. Government needs to be able to say, we want to build a healthcare system. But simply, right, when I come back to one simple example here, we know that up to 25 million people are using healthcare, and a large part of that are using it through cash. Through regulations and reforms, we can introduce a low-cost benefit option to access primary healthcare in the private sector for 350 Rand per person per month. And that'll give you kind of almost unlimited primary healthcare, etc. And that is an opportunity, to provide access to the public now, primary healthcare now. Now, many people are talking about NHI. Unfortunately, and it's actually in the minister's affidavit. NHI will only be a reality 10 to 15 years. So that means by 2040 is where NHI will be. So do we have time to wait to 2040? No. So my view is we need to act now, and there are means and measures. One, to manage the costs of healthcare. There are opportunities to increase packages because we need to a more productive and healthier South African base increases our GDP, increases our productivity. And currently in our economy, that's what we need. We need levers and drivers that's going to improve our economy.
So the sense that I'm getting is that it will take all hands on deck. And Mr. Naidoo, a functioning universal system requires a stronger, public primary care platform. Just what concrete investments should be prioritized, say, for instance, in the next 3 years, in terms of the workforce, in terms of supply chain, facility management, as well as the other tools that would also come into the fray?
Sure. So across the globe, anywhere you look, primary healthcare is the backbone of any healthcare system. We need to be able to make sure that everyone is able to access primary healthcare in an affordable solution. So that means, firstly, that we're able to link people to a doctor, to be able to see that. And we need to do it in a financially sustainable place. And that means sometimes, particularly the working class have to take taxis, transport, etc., sometimes take a day off. We need to remove those obstacles. And one way of doing that is through digital technology. So being able to use your smartphone, one, to be able to call a doctor, to be able to order medication delivered to you. And these are convenient ways to reduce the delays in the queuing systems we have. And then one of the most important things is we need to be able to have an electronic health system. If you can do that, you reduce the time that it takes to re-diagnose or to check what is wrong with the person, but you understand how that person's health is actually either improving or degenerating over time period. So, for me, it is get a right package, which is the low-cost benefit options. Make sure we're able to have electronic tools like electronic health records, enable platforms for digital technology and really look at actually, we've got over 1,800 doctors that have been employed. It's not that we absolutely critically need those doctors. We need to be able to get them to be able to see patients, and be able to make sure those patients are getting healthier. And then lastly, I want to say, let's move away from fee-for-service. Let's move towards value-based care remuneration models.
Yeah, and you're painting that picture, Mr. Naidoo, of that perfect world, and just the sustainability. Let's talk about sustainability there, particularly when we look at some of the communities here in South Africa. I'm talking about the far-flung areas, such as your Ikopo and how some of those rural communities would be able to access some of those services that you talk about that would be happening in this world, but also just the sustainability of that working.
Yeah. So, as part of our actual symposium and recent engagements, we've looked at how digital technology can literally help support remote patient monitoring. So we've got, for example, now tools that are far advanced in the private sector, which is where a patient can have a hospital at home. He's monitored virtually, if anything's going wrong, it's basically being able to pick up. So in a rural area, right, we are talking about the same sort of patient monitoring. They don't need to travel hundreds of kilometers. Through accessing a phone, we've now got phone technologies that literally, as you put it there, it looks at your face and able to tell you your vital stats, your BP, etc. And that's able to tell you, if you need an intervention, which means you need to take a travel to go see a thing. But those type of tools and technologies means we're always on. We're always able to access healthcare. As well as, some of the encouraging things that, which does come with the cost issue is we're seeing a lot more in surgery. Diagnosis, in terms of with a smartphone, you can diagnose cancers remotely. So simple things like Google, etc., can diagnose skin cancers. There's various other technologies. But now operations are being done over the internet, if you can say, over like a broadband connection. So you have the robotics that is in a particular place, but the specialist may be somewhere else in the world. And we've gotten to a point where we're doing precision surgery. And that is quite exciting because it means then, you don't always, and especially in an under-resourced country like us, where we are short of specialists, we can have specialists pooled in a particular area serving remote parts of various rural areas. So these are some of the technologies that increase access, for the far-flung areas.
Look, I must thank you so much for your time. That is Thoneshan Naidoo, who's the Chief Executive Officer at Health Funders Association. Thanks so much for your time on the agenda.